everyone. My apologies for that. Thank you so much for being patient with us, and welcome to today's weekly COVID-19 situational update. And I want to thank you as well for adjusting your schedules to meet on the Friday instead of yesterday. If there's one thing we're all very good at now, I think it's pivoting. So appreciate your patience and flexibility today. Very pleased to have with us today several of our elected officials, and we will invite them to share a few words if they'd like after Dr. Pigott shares his remarks. So with that, let's take a moment and acknowledge the land today. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. All right, I would now like to invite our Board of Health Chair, Andy Mitchell, to share some opening remarks. Please go ahead, Mayor Mitchell.
Thanks, Brittany. I want to begin my comments today by once again recognizing all our healthcare professionals who are working hard to serve and protect members of the Peterborough region. Public health staff, hospital staff, primary care workers, those working in long-term care, paramedics, other first responders, pharmacists, and many others. You have shouldered the burden of protecting family, neighbors, and community. I am proud and grateful for your service and honored to be part of a community that includes you. I want to recognize our educators, our students, and their parents. We all know that in-person learning is best, that efforts are being made to keep people safe. The public health is carefully monitoring our schools. Nevertheless, we see that it is scary for some students. Scary for teachers and others working to keep them safe. Scary for parents who are trying so hard to know and do the right thing. I also want to recognize and thank all those who have gotten vaccinated. 89% of adults in our area have now begun a course of vaccines. Each day, more step up. And half our children aged 5 to 11 have a first dose. Peterborough Public Health staff are working hard each day to expand that number. Yesterday, Ontario officials talked about a glimmer of hope. I know we can use some good news. However, we need to keep utilizing all the basic measures we've counted on to keep us safe. Things like masking, staying home if we are sick, and getting together outdoors instead of indoors whenever possible. We need to make sure that the next steps we take work to brighten the sky and not unintentionally let the clouds return. Public health and its employees, guided ably by Dr. Pigott, are our strength and one of our greatest resources as a community. Dr. Pigott and his staff are guided by a passion to serve, a passion to promote and preserve the health of our community members, and a passion to make the lives of our residents better. And the Peterborough region, I know, is a loving, generous, caring community. It's a place where people lift each other up, where each person is valued, and where we encourage and support one another as part of a broad community. The Peterborough region, I know, is not the atrocious behavior that has happened in recent days in our community. This behavior, this intimidation shocks us all. Not because disagreement is wrong, but because intimidation and bullying is wrong. Every citizen of our province has a right to a unique opinion about the pandemic, but the expression of such a right must be peaceful and must not impinge upon others' rights. A difference of opinion is not a license to intimidate or bully or harass. Protesting at someone's residence is simply wrong. Through these difficult times, we need to lift each other up. That is the Peterborough that must prevail. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, let's invite Dr. Pigott to walk us through our current data slides that we have here. So please go ahead, Dr. Pigott.
Thanks, thanks, Mayor Mitchell. Thank you, Brittany, and good afternoon, everyone. I'm going to start with our good news on continued progress and the tremendous work our whole staff are doing on rolling out a vaccination. It feels like just moments ago we passed the 300,000 threshold, and here we are over 18,000 doses beyond that. You know, vaccinations remain strong, and that coverage is excellent. I think that we have progress to do, and I hope that folks who haven't had their chance, especially in the 5 to 11 population, if you go on to the next slide, Brittany, will I hope that folks will come forward to be vaccinated. We have a lot of progress to do, especially for this population, and the protection from the vaccine is such a tremendous importance. I want to note that the Healthy Planet Arena is also now accepting walk-ins for our 5 to 11 first doses, and so we want to make it as easy and accessible as possible. It's great to see that our second doses are also starting to climb up, and a final note on vaccines for this group. Over the coming weeks, we'll also be doing some in-school clinics, and consent forms will be sent home with parents regarding accessing those opportunities. On to our next slide, you can see here from the Ontario Science Table the effectiveness of at least 2 doses of the vaccine against prevention of ICU admission, hospital admission, and infection with COVID-19 or the SARS-CoV-2 virus. And what I'm very encouraged to see is that as more people are getting boosters, it definitely appears that prevention against infection is increasing. This is obscured a little bit by case counts, and on the next slide, Brittany, and eligibility for PCR testing, because we now have a more narrow range, sorry, next slide, of the individuals who are eligible for PCR testing. And what this is showing now is that our confirmed cases, the number of active cases that we're tracking on our dashboard, is really the tip of the iceberg of transmission out there. We know that it has decreased by half, but that decline is due to less testing and due to the narrower criteria in testing, not due to a decrease in transmission. And I'll come back to that shortly. Sadly, we are reporting another 7 deaths this week in our community since our last briefing, and I will share more of an analysis about this a little bit later in my remarks, but it's really upsetting, and my sincere condolences to the families of those we've lost in this past week. On to the next slide, Brittany. COVID-19 hospitalizations at our hospital have increased and are at a concerning level, with 34 hospitalizations, 5 ICU admissions, from data that we've received from PRHC, as well as an indication that there are many suspect hospitalized cases that do not necessarily have a confirmed test result, but are also hospitalized. Encouragingly, the team at PRHC has done a tremendous job, and since last week we're down from 3 active outbreaks that they're fighting to 1, and I think they've done a tremendous job, and want to send kudos to the whole team that's working closely to keep people in hospital as safe as possible. But we're also hearing from our hospital long-term care and health system colleagues that staffing remains a significant challenge, and even though the numbers haven't grown to such a point of really destabilizing the health system in our community, the absence of staff home sick or as contacts is placing a tremendous continuous burden, and the hospital certainly wanted me to share the message that they are not through it yet, and they are continuing to see and feel significant stress, strain, and impact. On to our next slide, Brittany. You can see our usual case breakdown for the last 2 weeks of data, and it does again continue to show lots of transmission in younger populations and under 20s, especially driven by people who are 5 5 to 11 that haven't been vaccinated yet. And that's why we're emphasizing the need for vaccination in those groups. On to the next slide, Brittany. We're managing 19 active outbreaks, and there is a range of settings that those outbreaks are in, and these continue to be a significant concern, especially in congregate living settings, where people live together, long-term care, retirement homes, shelters in our community. On to the next slide, Brittany, you can see here, and I'm going to share a little bit more detail about our deaths now at this point. So this slide demonstrates the whole pandemic and our case rates. So work with me for a minute or two here, and I'm going to help to explain the trend that we're seeing more recently in deaths in our community. So this slide shows in orange, or the top line, those who are in Ontario, the rate in Ontario as a whole, and the PPH blue line, which is the lower line, shows our own rate. Rates mean that they're standardized to a set population, in this case per 100,000 people. And as you know, our region's a little over 1.5 times that, about 1.5 times that for a population. So what you can see around the number 15, which across the bottom, that axis is just showing the week. And of course, we started this pandemic in 2020, and around late March is when the first wave starts. And you can see the blue line far below the orange line there at that point. Fast forward to 45, and we start to see the impacts of the second wave. Again, the blue line, our Peterborough numbers, remain dramatically lower, less than a third of the provincial numbers through the second wave. When we then started vaccinating through the third wave, they remain dramatically lower. And as we get into this fourth wave and the Omicron wave, what you can see is that Peterborough Public Health numbers are actually more matched with the provincial numbers, and this is therefore the highest burden of infection we've ever had. If we go on to the next slide, Brittany, when we look in detail over the last number of weeks, we've seen our death rate now steadily be higher than the provincial average death rate. But if you go to the next slide, Brittany, what you'll see is the same time horizon of the 2 years of the pandemic and our death rate through the previous waves of the pandemic. And you can see that, like the case counts I mentioned earlier, they were far lower. And so what I think we are observing here, and if you go on to the next slide, Brittany, we have some data on our specific deaths reported in the last week. But what we are seeing reflected is that we have an older and more vulnerable population in our region to severe disease and death from COVID-19. And while we made it through previous waves with less infection, a far lower rate of infection, and therefore a far lower rate of death, in this fourth wave and now into Omicron, our rates of infection have been around the same as the provincial average, but our underlying vulnerability because of age, the number of long-term care and retirement residences in our community, and other risk factors has meant that our vulnerability to death is higher in this community. So what I believe we are seeing reflected is the trend that, while we fared better through the previous waves, this wave, we have not fared better than Ontario in terms of the infection rate, and therefore our death rate is appearing higher. And the average age in our region is 5 years older, is 44 instead of the average age of 39 in the province as a whole. So we know that we have an older population, more of a retirement community, larger numbers in long-term care and retirement residences. And this is what we are now seeing. And I'm so sorry to share and report these numbers. These deaths really are quite concerning and tragic. More deaths this year than in any phase of the pandemic already so far as a whole, and that is 12. We've had 12 deaths since the beginning of the year already in the first 21 days of the year. So we are tracking this very closely. Here's some information on those deaths. Again, the most concerning trend is the deaths in unvaccinated. while some people did die with the vaccine, we know that nearly 9 out of 10 people are vaccinated, so that would be expected. The rate or the risk for people who are unvaccinated of dying remains much, much greater than for those who are vaccinated. And this is holding true with the data and trends we're seeing in this community. On to the next slide, Brittany. We're going to talk a little bit about our wastewater surveillance data and segue into a bit of an assessment of where I think we are in this wave in the pandemic. Here you can see that wastewater surveillance data shown for the 17th of December to the 19th of January. And what you can see is the case counts. The main one you can see, which is the largest, is in Peterborough. And the orange line, the top line following along, is the average for the wastewater surveillance data that we're seeing in that same time period. So what you observe at the end is the red bars are decreasing. We're seeing a decrease in the case counts. Remember, the case counts are now a tip of the iceberg because of the criteria for who can get a PCR test to confirm. And the wastewater surveillance data has also declined just a wee little bit, but it's still very high. And that to me tells me that we have seen a plateauing of the transmission, but not a steady decrease in decline that we should take refuge in and take too much hope in yet. And that is because the decreases we're seeing are no doubt because of the measures put in place January the 5th with provincial public health measures and school delays. But I do anticipate that may change, and we may yet see a peak that is higher in the coming days and weeks. On to the next slide, Brittany. I want to talk a bit about that because as much as there's some signal for hope here in the current situation, what is most important is understanding where this situation is going. And I liken it to the weather. If you look outside and see the sun, that doesn't mean that you're not going to get a storm for the next little while. What is important to know whether you're going to get a significant and concerning storm is the weather forecast. And forecasting or modeling is really important. And so I hope that we will see new information and data from the Ontario Science Table to support some of these decisions. And some of the evidence around this, because the concerns that I'm hearing from our health system partners in this community are that they're not feeling like we are cresting this yet, and that the health system is still very much under attack. Staffing crises in healthcare continue to be significant. On to our next slide here, Brittany. I want to talk a little bit about one question in advance around individuals who may have been diagnosed with myocarditis following a vaccination with an mRNA vaccine. And a reminder that the concern of myocarditis is one that we've been tracking very closely because we pay very close attention to every single safety signal. But a reminder that you're much, much higher risk of something like myocarditis after infection from COVID-19 than from vaccination with COVID-19. And a reminder that the guidance has now changed. And so if somebody has received one dose of the vaccine, but experience something like para or myocarditis, they should see their healthcare provider for a discussion on proceeding. But generally, if they are deemed eligible by their healthcare provider, they should proceed with another mRNA vaccine and get another dose. The safety for those individuals remains high, and the protection remains really important. So again, we may be seeing some blunting of the wave, and there is no doubt some cause for hope, but I think that that is related to the great work we've done getting booster doses out, tightening public health measures, delaying the school opening, and I think we need to be very measured in the coming weeks so that we get through this well together. I want us to talk briefly about schools, and with schools now resuming in-person learning, the reality is it is too early to know whether the number of cases and the transmission we'll see in those settings will increase again. And so right now, what we need to see eventually to consider COVID as endemic is that the peaks and valleys of this roller coaster of waves that we're experiencing stabilize off to a more constant, predictable, manageable level for society and for our health system. I'm really hoping that spring and the summer will be better. You never know, we may see new variants. We may need to look at measures to protect us into the future, but those need to be balanced with the potential trade-offs of those measures at any time that those decisions are made. So, I think we're well on our way to COVID becoming endemic, and planning is there, but we are not there yet. I want to speak briefly about the measures that we communicated out to parents yesterday for local schools, and that includes more intensive monitoring of several sources of data and making decisions to protect our kids in schools on that basis. We are looking at the absence rate of people attending schools. We are looking at the results that are reported to us on rapid antigen tests. And please, we would really encourage you to submit both positive and negative test results through our survey and the QR code held here. We strongly encourage people to get vaccinated. And if we do see trends of COVID-19 transmission in schools, looking at our PCR tests, our rapid antigen tests, and absence rates, we will be recommending the dismissal of children who are not fully vaccinated as we continue to protect them and our schools in this pandemic. If we just to finish and continue, I do just want to say a personal thank you for all of the outpouring of support to me, to our team, to Peterborough Public Health over the past week. It's been an especially difficult time. I'm also especially grateful for the support of all of the police officers who've been involved, who've helped our family in the past week. I want to say a particular thank you to Chief Gilbert, who I've been on the phone with multiple times and has been a constant support so that I can allow them to do their job and that I can focus on my job, which is protecting this community from this pandemic. I also want to take a moment to thank the contingent of social media support, and you all know who you are. People paying close attention and correcting misinformation online. And I also appreciate that people are identifying concerns on social media. And I appreciate that they are flagging to police so that police can do their job. I want to end with a reminder that the remedy to violence is not more violence. The remedy is justice. And the remedy to hatred is not more hatred. It's love. Thank you, and I'll turn it back to Brittany.
Thank you so much, Dr. Pigott. Okay, we have with us several of our local elected officials, so I'd like to invite them to share a few words, or if they just want to be available for questions, that's fine too. Let's start with our MPP, Dave Smith. Did you have any remarks to share today?
Thanks, Brittany. I really appreciate that. I'll give a quick update on the situation with rapid tests. The province has procured more. They have not been delivered yet. We did receive some disappointing news from the federal government. The $15.5 million that we were scheduled to get in December, we received just over 2 million of them, and we've been informed that the other 13 million will not be coming. They still have maintained that we will be receiving 43 million rapid tests from the allotment that is coming into Canada, but it does put us backwards a little bit on what we were expecting to do with them. We do believe by the end of the month we will have a good steady supply of them, and we've been able to acquire a third type of test, which is a little bit different in its process. Using it is exactly the same for the end user, but the testing process itself is just slightly different. Looking forward to having those come in so that they can be distributed throughout the community and ramping up the rapid test usage. I do want to address some of the protests. I've said it repeatedly. I will say it until I am blue in the face. It is never appropriate to protest at anyone's home. That is their private property. That is where their family should feel safe. And any individual who steps foot on someone else's private property and tries to intimidate another individual, that is 100% wrong, and it should never be accepted by anyone in our community. It should never be promoted by anyone in our community. I greatly appreciate the outpouring of support towards Dr. Pigott and his family as a result of what occurred both on Saturday and this past week. But it's not appropriate for vigilantism and for others to then go protest at the protesters' homes. Please do not do that. Rise above. We are better than that. Thank you.
Thank you very much, MPP Smith. Okay, let's hear from Warden Jones. If you've got some comments or if you just want to be available for questions, that's fine.
I'm here on a one-way look here, Brittany. Thank you very much for having me. Again, I want to emphasize that the County of Peterborough, we're certainly doing everything possible to obey the rules. We're working from home where possible. And I always like to shout out to our staff who are doing what they can do, especially our public works employees and our paramedics. They really are going above and beyond the call of duty. I guess I'd be remiss too if I didn't weigh in on this situation about Dr. Pigott and a few people who think they have some kind of right to interfere in his private space. I'm just totally disgusted with it all. I know all of us in Peterborough County are identical. You know, our community, and when I say our community, I mean the city, the county, Curve Lake, Hiawatha, that's our community. We were built on working together. We were built on love and respect for each other. We've gone through good times and bad times together, but we've always stood there and have done the right thing. I'm disgusted that there are people in our community who feel they have the right to do that. Give me a break. I suggest those individuals have a collective look in a great big mirror. I don't think they'll like what they see. So let's stop that nonsense right now. And Dr. Pigott, I think we all owe you, on behalf of those few, a collective apology. And you got to know that the rest of us are doing our best to do the right thing, and we're standing behind you 100%. So don't ever feel you're alone. We're with you. Thank you, everybody. Let's keep doing the right thing. We'll get out of this before we know it. Thanks.
Thank you very, very much, Warden Jones. Okay, and finally, we have Mayor Diane Therrien with us from the City of Peterborough. Did you have any comments or just want to be available for questions, Mayor Therrien?
Hi, Brittany. Just quickly, thank you to Dr. Pigott for all the work that he's done, and certainly I agree with my colleagues in condemning this nonsense behavior that we're seeing in the strongest terms possible. Also, just wanted to let folks know that Dr. Pigott will be joining me on Instagram Live next Thursday, the 27th at 7 p.m. So we'll be talking about a variety of issues, and I'm really looking forward to that. And I'm very appreciative to Dr. Pigott for the leadership that he's demonstrated since coming to this community. We're very lucky to have him. Would also just say that the city is reviewing and will be providing updates on the changes that are coming as per the provincial regulations that are coming into effect on January 31st and what that might mean for city services. So just to keep an eye on that, because we will be providing additional updates as we get closer to that date. And that's it from me. Thanks, Brittany.
Great. Thank you so much, Mayor Therrien.
Brittany, if you don't mind, I did miss one thing.
Oh, sorry. Go ahead, MPP Smith.
Thank you. On Tuesday evening, we'll be holding a telephone town hall for the entire of Peterborough County with Dr. Pigott, Dr. Mikula, and myself to talk about vaccines, COVID, and so on, and answer any questions. So please wait for the phone call, and when you get it, we'd love to have you join us. Thank you.
Great. Yes, that we're looking forward to that on Tuesday, January 25th, I believe. Okay, so let's hear from our media guests, and I'm also pleased to share we have several of our enforcement partners on the line as well. Let's start with the Kawartha Now reporter, Paul Rellinger. If you've got some questions for Dr. Pigott, please go right ahead.
I do, Brittany. For Dr. Pigott, if I could, and then a question, if I could, for our law enforcement representatives. Dr. Pigott, you mentioned, I think the word you used, some blunting of the wave, and how that's an encouraging thing. I'm wondering, though, with the province now lifting some restrictions, I believe, by the end of the month, how do you counter that with some blunting of the wave? Are you happy with what you've heard from the province regarding the lifting of restrictions, or do you think it's too soon?
Thanks for that question, Paul. I think all of these decisions are always very difficult ones that involve much more than just my public health expertise on the transmission of COVID-19. There are always other factors to consider around the impacts of measures, and I think that it is a difficult task for any government to consider and reflect and balance those things. So, I mean, I don't have the information that they do. I think it would be really helpful to see and hear from the Ontario Science Table to help to have that encouragement. Just because at the local level, I continue to hear significant concern from our hospital and health system partners about the burden that they're certainly facing through this.
Thank you for that. And at the risk, Dr. Pigott, of giving some people who don't deserve any more press maybe a little more attention, I want to talk a little bit about the protests, and not just the protests themselves, but the escalation of the protests. You know, they were in a park, they were downtown, then they're outside your offices down on King Street, and now, as you're well aware, they were at your home. How concerned about you, not just for your own safety, which you should be, but just for healthcare workers in general, that there's been a steady escalation here, and we really don't know where this could possibly go, or if we've even gotten to that point yet.
Thanks, Paul. I think I'd be lying if I said I was okay. But I'm here and I'm doing my job, and we're doing the best that we can. And I know lots of healthcare workers and our whole team is.
Dr. Pigott, do you know, it's no problem if you don't, you may not be aware, is this the first, or maybe this is a question for law enforcement, the first charge that was laid under the new bill in Ontario?
I think that would be better directed. I'm not sure the answer to that question, but perhaps if our police partners have input on that.
Thank you, Dr. Pigott. And if I could ask the police representatives if that's the case.
Let's start with Chief Gilbert, if you've got some comment.
Thank you for that, Brittany, and thanks for the question. As far as we know, it is the first time it's been laid, that charge, but the act only came into force on January 17th. So it came into effect after the first protest outside the doctor's house and the intimidation that they were trying to level against Dr. Pigott and his family. So we are still investigating that. We have identified a number of suspects, and we will continue the investigation and see whether or not charges will be laid in relation to that for things such as mischief, criminal harassment, etc.
Thank you, Chief Gilbert. And just one more thing, and I know you can't give too much away, and you shouldn't, but in light of the recent incidents that have occurred, would it be fair to say that Peterborough Police Service is keeping a particularly more watchful eye on certain areas that could become an issue, such as Dr. Pigott's neighborhood, or even the health unit down on King Street?
We pay particular attention to what we believe are all potential hotspots. So, I'm not going to give away everything that we do in relation to that, but certainly we are aware that there are some areas that attract more attention from this particular group of people, and that's as polite as I'm going to be talking about them. And as a result, we gauge our activities in relation to that.
Thank you for that. Thanks for being so candid, and thank you, Dr. Piggott. That's all for me, Brittany.
Thanks, Paul. If I can just add too, I also want to say that I think I also recognize the tremendous privilege that I have. I mean, online and in person, the worst that people are leveling at me is making fun of my last name, renditions of Piggott. If they think that's, novel or going to stick, they obviously haven't spent any time in a schoolyard. But if I wasn't a white, male, cis, gendered settler, I hate to think of the further vitriol and hatred that I'd be experiencing, and I have huge empathy for my colleagues and people that may be experiencing this even more difficult.
If I could, Dr. Piggott, at a time like this, when you're obviously dealing with this, and no one should have to, what comes to mind that counters that quickly for you? I know you've only been in Peterborough, a few months now, but surely it's been long enough to get a sense of what the community is all about and the people you work with. How do you counter those feelings of disappointment?
I think it's a work in progress, but I've just seen such a tremendous outpouring of support and kindness from our neighbors, from people in this community, messages that we've gotten, offers of support, all kinds of incredible support. I know that overwhelmingly we've got great support, and I know my team appreciates that. We continue to just do the best job we can.
Well, thank you, Dr. Piggott. And if I can add on a personal level, thank you for all you do, and Peterborough Public Health staff. I appreciate it.
Thank you very much, Paul. Okay, I'll invite our global representative, Tricia Mason from Global News, to ask her questions. Go ahead, Tricia.
Hi there. Thank you all for being there. And Dr. Piggott, on a personal level, from me, I just want to say I'm sorry for everything you and your family are going through with all this. Most of my questions were answered there by Paul, but I have a colleague of mine working on a story about the frostbite warning. Did you have anything you wanted to say on that to community members?
Thanks for that question. Our work around that, I think, remains tremendously important, along with partners, especially partners from shelters and other aspects of the city and region delivering services. The impacts of cold are not felt proportionately. It's easy enough for those of us who have a safe and comfortable home to turn up the heat and sit by comfortably, not even understanding and knowing what's going on the outside. But I think it's tremendously challenging for some people, and the supports and response through cold alerts, I think are very important. More broadly for everyone, it's a time to take care when you are outside. Make sure that you're very well protected and covered from frostbite, especially coming into the weekend. If there's activities and things that you'll be doing outside, take good care to protect yourself and your family.
Great, thanks so much, and I hope you take care, and thanks for everything you guys are doing.
Thank you very much, Tricia. Okay, let's hear from Matt Latour, our local radio station rep. Great to have you with us, Matt. Go ahead if you've got some questions for Dr. Piggott.
Thank you. I'm using my home microphone today. Can you hear me? Is this working?
You sound great.
Wonderful. I'll take that. My question, I only had one today. Paul kind of touched on the other ones I was going to ask. It was more so about what we're seeing in the UK. I know that they were a little bit ahead of us, about a month and a half when it comes to the Omicron variant. And now I see an announcement that they're lifting masking rules as well as vaccine certificates. Do you think something like this will be the same kind of delay here in Ontario, or do you think it's a little bit too different to gauge because of different populations and whatnot?
Well, it's tough to tell. I think that these are all things that we're all looking forward to at the right time. The question is timing, and we're still in the thick of the storm at the moment. So it's too soon to to say exactly when a more normalcy will be felt. I think with any measures, it's important to think about what the unintended consequences are. You know, closing a business, keeping kids home from school, those are things that have a dramatic, more significant impact on people's lives than things like continued, precautions around mask use and even some of the other measures and mandates. So I think that it's always a balance of the benefits to preventing the spread of COVID and the impacts that that has on people's lives. But I know that the government will be considering those things to protect Ontarians.
Perfect. That was it for me today. Thank you.
Awesome. Thanks so much, Matt. Okay, Danelda Fraser is joining us from Havelock today. Any questions for your publication, the Havelock Rail, Danelda?
No, not today. And I'd like to thank Dr. Pigott. And I feel sorry that you've had to go through this. And that's all I have to say.
Thank you so much for your kind words. Okay, Bill Hodgson's joining us from Peterborough this week and the Examiner. Go ahead, Bill, if you've got some questions.
Just a couple of questions about the rapid tests. I know when they were handing them out before the library and at the fairgrounds and such, a lot of people, when they got their package of 5, at least I've heard, tucked a couple away for emergencies or when things get worse. Is there a concern that you need to use them before too long because they expire or become less effective? Is it a good idea to tuck a couple away, or should you be sharing these out to people that might need them now?
I see there's a hand up, but sorry, that might be in relation to that. I think that the test boxes have an expiry date labeled on them, and that would be when they should be used before, obviously. I think that it is reasonable to keep 1 or 2 just in case you develop symptoms and you want to know whether it could be COVID or not. But I've always encouraged people to not hoard, and if they do have, to share around as best as they can within their family, friend network. You don't need to be sitting on massive stocks when we're in such a tight supply chain context as MPP Smith has articulated. But if you do develop symptoms and you are concerned, that's the time to use these tests and to help to then stay home and not spread infection. But again, if you don't have access to these tests personally, that is not the end of the world at this point. You should be still following the measures, and if you're sick, staying home to prevent putting others at risk. But because MPP Smith has a lot of interest and expertise in this, I wonder if he has anything he wants to add on that.
Is he there?
I think he's coming on. Nope.
We didn't hear him until now. We can hear him, I think. Go for it.
Sorry about that. So the tests themselves are good for 12 months after they have been manufactured, as long as they are kept within the confines of the temperatures that they can be. The PanBio test kits, if they freeze, throw them in the garbage. If you have one of the BNXT kits and they freeze, they can be used within about 48 hours. If you don't use it within 48 hours, throw it in the garbage. So those are the 2 types that we currently have in circulation. It's fine to hang on to them for a period of time if you so choose, because they won't expire for probably 10 months from the time you got it. But do be very careful about the temperatures that you store it at. PanBio, if it drops below 2 degrees, the testing fluid is absolutely no good and you have to throw it out. The BNXT, the small green packages, if they freeze, they're good for about 48 hours and then they have to be thrown out.
Okay, and while you're on here, Dave, just another question about the rapid test. Disappointing to hear we're going to getting so many less than expected. But the ones that do come in, do you know, are they going to have events or pop-up handout events, I guess, places where they're going to hand them out?
Yeah, so our priority focus on the rapid test right now is for healthcare, for long-term care, for retirement homes, schools, and first responders. Depending on what happens with the tests in terms of the delivery, we can expand into more of the general public again. But until we have that solid, steady supply, we can't make any commitments that they're going back out to the general public until that time.
Thank you. Thank you for that and your other answer. That's all my questions for today. Thank you.
Great. Thank you so much, Bill. Okay, Reg Watson, if you've got some questions for us from the examiner, go right ahead.
A question for MP Michelle Ferreri.
She's not on the call today, unfortunately.
Then I will direct to Constable Ayotte or Staff Sergeant McLean, Inspector Lyons, or Chief Gilbert. I wonder if you could go over for the average person the meaning of the Bill C-3. It sounds like the two people who were arrested this week were kind of oblivious to the bill, if not to policing in general. And I don't know how much of the public understands this new intimidation charge and the consequences of it. And also just your expert opinion on whether you think it will be an effective deterrent.
Okay, maybe we can start with Chief Gilbert, but if you need to defer that or refer that on, go right ahead.
Well, you did ask multiple questions there, so let's just start with what your first question is. If you want to break it down a little bit smaller.
Yeah, sure. Just a general primer for the average person on what is Bill C-3 and what are the consequences for somebody charged under the bill.
Well, Bill C-3 was a bill that part of it creates an offense and a punishment for people engaging in acts of intimidation against healthcare workers, about blocking access to healthcare facilities. There was another portion of the bill that added sick days in there, but the main thing has been to protect healthcare workers from acts of intimidation and allow them to go about their very important job of keeping the rest of us safe and allowing us to get through this pandemic healthy. The charge under Bill C-3 is, if it's preceded by indictment, it could carry a punishment of up to 10 years in jail, or much lesser punishment if it's preceded by way of summary conviction. Another offense that's in the criminal code is called criminal harassment, where you engage in a pattern of conduct or you communicate with somebody in such a way that you cause them to fear for their safety. And again, criminal harassment is also punishable by up to 10 years in prison if preceded by indictment, or a lesser amount of time if preceded by summary conviction. So, ignorance of the law is no excuse. So to your earlier point that they seem to be oblivious of it, that doesn't make any difference for proceeding under the law, that they seem to be oblivious to it. And again, that's something for a trier of fact to determine.
Following up on that, is there any word from the Crown's office with these Peterborough charges? Will they be pursued under IO?
That's up to the Crown when all the evidence is put before them to make a determination as to what the best mechanism to proceed by is. So I'm not going to speculate in relation to that. Obviously, it's still an ongoing investigation. There's more work that needs to be done, and we'll give as much information as we can to the Crown's office, and then they can make an informed decision as to what direction they want to take in relation to prosecution or not.
And again, just a general comment on how effective you think this would be as a deterrent to what we've seen over the past month or so in Peterborough.
Well, I think if people start getting arrested and put on bail conditions, and then they breach their bail conditions and end up getting arrested, show caused, and held in custody until their trial, think you could see some changes in some people's behavior. Granted, some people may not want to change. They may want to continue their behavior, at which point in time we will continue to lay charges as appropriate. And with everything that's gone on, it goes without saying that if you attend at a healthcare worker's home and engage in the activities that they've engaged in over the last week, that is causing fear in healthcare workers, and you should be on notice that you're causing fear in healthcare workers, and you will be subject to what the legislation states right now. We will arrest as necessary, we will lay charges, and we will put you before the court.
Okay, thank you for that.
And that, it also includes, Reg, going to other people's houses where you're trying to intimidate them. We've heard that protesting, if you're going to protest, go to City Hall, go to Queen's Park. You don't go to someone's house. You may have a beef with that particular person or think you're delivering a message to them. But as we've seen across the province, you're inconveniencing all of that person's neighbors as well and causing fear in their households. And that's just unacceptable.
Okay, thank you.
Thank you very much, Reg and Chief Gilbert. Okay, I think we have gone through everyone who's joining us from the media today, so thank you again. We will wrap it up for today. Thanks again for joining us on a Friday. We'll be back next Thursday at 12 noon. And do stay warm out there. Give a call or send a note to someone to check in on them. Make sure they're okay with the extreme cold. And have a good weekend. Take care all. Bye-bye.
Thanks, Brittany.
Goodbye.